Blackstone presents The Return of the State and Why It Is Essential for Our Health, Wealth, and Happiness by Graeme Garrard. This book is read by Thom Rivera. To David Hanley and James Bernard Murphy. Introduction. In mid-Victorian Britain, in the bleak world of Charles Dickens, before the welfare state existed, access to health care was almost entirely a matter of social class. The tiny upper class and most of the middle class, then very small, paid for their medical treatment out of their own pockets. The doctor's basic fee of 6 pence plus the cost of the medicines he prescribed were beyond the means of the vast majority of people. A home visit by a private doctor enabled the well-off to avoid going to a hospital, which was then widely seen as a thoroughly unhealthy place. For the rest, there was a system of voluntary hospitals supported by charities and staffed by volunteers, and publicly funded and underfunded workhouse infirmaries. The lucky few were admitted as patients to voluntary hospitals, which accounted for about a third of all hospital beds in England by the early 20th century. Sometimes individuals were required to make some financial contribution to their care if it was judged that they could afford it, although most were charged nothing. Membership in a community-owned mutual aid fund, medical club, or work-related insurance scheme enabled some working men to pay small regular premiums to cover the cost of health care should it be needed, particularly for medicines, although their family members were not usually covered. For the destitute poor there was the dreaded workhouse, which Ebenezer Scrooge cruelly commended for their useful course. These grim institutions, so powerfully evoked by Dickens in his novel Oliver Twist, were the last resort of those who could find no other work. Workhouse inmates labored in return for a meager subsistence. If they became ill, as they often did in such conditions, they were kept in the crowded, unsanitary, and badly ventilated infirmary, where they received the most rudimentary care from overworked and often demoralized, and not infrequently drunk, doctors. Imagine what the world would be like today, in a global pandemic, under such a Malthusian system, even if a vaccine was available. Your health would depend on the whims of charity, your ability to pay private corporations, or your place in a hierarchical client-patron network.
Sample complete. Ready to continue?